Thank you for having me. My name is Janti Soeripto. I'm the CEO and of Save the Children in the US, and I'm here with two amazing advocates that we work with, Maryann Broxton from ATD Fourth World, and Ashleigh Stocton, one of our amazing SCAN, Save the Children Action Network advocates from Tennessee. And we'll talk a little bit more about them in a minute. First and foremost, congratulating JPAL, Esther and Abhijit and the team so much on 20 years. It's amazing to see all of it. I'm also mindful that this morning, most of the examples and the work that have been discussed have been about international development work, international research projects. I love those examples from my home country, Ben. But we're now going to talk about poverty in the United States. Real poverty in the richest country on this planet. And I know this is a data-loving audience, so let me throw some data at you then, because normally I have to reduce that and talk about stories. 40 million Americans, over 12%, live in poverty. Children make up a disproportionate amount of those in poverty. 11 million American children live in poverty. Yes, debatable definitions, etc. The United States apparently does not have one definition for poverty and does not have one definition for rural. But those quibbles aside, the numbers are staggering, and child poverty rates, after that very welcome drop during the pandemic because of the child tax credit, now the numbers have gone back up to exactly the same percentage that we had before the pandemic. So Save the Children has been working for kids in rural communities since 1934, Eastern Kentucky in the Depression, and we're still working across the country in over 300 rural communities, delivering early education programs, ensuring kids have access to good nutrition, working with the moms, the dads, the parents, to make sure that everything that children need is available, or that they know how to get access to these programs. And that programming is really essential, and we're proud of it, but it's never going to be enough to really get to scale and to really shift the needle here substantively. For that, of course, we need community engagement, real evidence of our impact, and policy change. The Save the Children Action Network is actually a C4. We advocate at state and federal level for the right policies, and we have 400,000 grassroots advocates, of which Ashleigh is one, across the country, talking to their lawmakers, their legislators. They come to the Hill to advocate for the right policies for children, like the Farm Bill, like easier access to SNAP and WIC. It's also really important, though, aside from all those numbers, that the lived experience of those communities and the people in those communities gets taken into account. And that's what we're going to talk a little bit about today, getting those voices at the table to make sure that we design those interventions from the get-go, that they are owned and embraced and led by the local community, we think really matters and makes a significant difference. A people-centric programmatic and policy design. So with that, we're going to have some questions for Ashleigh and Maryann. Maryann, I'm going to start with you. You are with the international movement of All Together in Dignity, a movement that Save the Children is proud to partner with on ending child poverty. You're also a representative to the United Nations, and you have lived experience of poverty. All Together in Dignity calls poverty violence, which I thought was a very telling and memorable statement. Could you talk a little bit about the work of ATD and how your experience has informed and impacted the work that you do?
Oh, yes, of course. Thank you. Thank you so much. And I really greatly appreciate that you gave out the full name, All Together in Dignity, because that's very important. That's one of the things that we usually overlook when we talk about people with a direct experience of poverty, you know, is that we respect everybody's dignity just because it's a human right and people deserve that. The work that we do in the U.S. is two different levels. We do a lot of work on the ground, grassroots level, in the communities with people. One way that we do it is through story gardens, where we go into a neighborhood, we ask them if we could come, first of all, we don't just show up and parachute in and try to be white saviors for everybody. We ask people what they need, what they would like to do. How can we partner with you and work with people? And so it usually starts with the story garden and working with the children, reading books and doing arts and crafts. And then usually the parents come. From there, it grows to ask what people need. One of the things that we did recently, a perfect example is in 2016 to 2019, we did the multidimensional aspects of poverty research, which included people as co-researchers on an equal footing with academics and practitioners. I was the U.S. coordinator for this part of the project. And what grew out of that was the people that we were in the peer groups when we were talking to them. Everyone was saying the interactions that we have with social workers are so negative. The way we are treated, but that's why I said thank you for mentioning dignity, that we are less than just because we're looked at as a circumstance and not a person that has gone through a system that has failed us as we try to navigate it. So out of that, listening directly to people, we developed a social workers training on the results of the MAP research. And we worked with a group of families that were either in social services as children and are now adults and have their own children and are being looked at again by social services because of the way they grew up and everything like that. To let them know that how are we going to change the way people are viewed. And they worked directly with the social worker students to see that, no, people are not clients, they're people. This is how you look at them first to begin with. To create mutuality between people and an understanding. The one thing I will say about ATD is that they create space like the social worker training group so people can work together and share that, and then they share the space so people can share their knowledge of what they have to the voices that need to hear it, usually policymakers and in different areas. I'm sorry.
It's great. That's great. That's super helpful.
Yeah.
And we're going to come back to that MAP project as well. So Ashleigh is a SCAN advocate from Tennessee. She's also a mom. She won one of our awards. She has a master's degree in ECE, early childhood education, and lived experience with WIC. Ashleigh has also been with us on the Hill to talk to our legislators and members of the House about things like SCAN, SNAP and WIC. Ashleigh, tell us a little bit about your journey with SCAN to become an advocate and an activist on these topics, and what happens when you tell your story to legislators or lawmakers? How do they react?
Yeah, so I've worked in the field of early childhood since I was 18 years old. I knew I always wanted to be a teacher, but I found that passion in that birth to 5 space because I think we forget, and many don't know, that that birth to 5 space is so crucial in a child's development. 90% of the brain develops by age 5, so we really need to invest in that time period. A lot of people think learning starts at preschool or kindergarten, but it actually starts when they're in utero and when they're with their mom. So that is something I was always passionate about, but I didn't know how to get my message out or how to talk with people about that. I was really insecure about that, but I knew that we needed to advocate for that. So when I was in grad school, and on Facebook, of all places, it said, are you interested in, advocating for early childhood education and children to have a healthy start at life? I'm like, yes, I do. So I got on, filled out my information. In Tennessee, we do have a established team. So the state manager reached out to me. I was actually in the car driving to Asheville, North Carolina, which is about an hour from where I live, and we talked the whole way. And from that point on, it just changed my life. I tell people when I got involved with SCAN, it really did change my life. I've never been a very involved in politics, kind of steered away from it and made me nervous. But something about SCAN is it is bipartisan because we do advocate for children to have a healthy start at life, because who wouldn't want that? And another thing is because children don't have a voice, they can't go and talk to our elected officials. So we have to be that voice for them. So that is how I became involved with SCAN in my journey. Now going to talk to elected officials, there's so many stories to share, but I think one big thing is when you build these relationships with these people, they remember you. And something about SCAN that we didn't talk about is we wear these red shirts that say Save the Children Action Network. And so they'll always remember you, and they're like, oh, you're the girls in the red shirts. So and then they'll remember our stories. Oh, you came to talk to me about the Child Care Developmental Block Grant, or you came to talk to me about the Farm Bill, and they'll remember those personal stories that we told them. And I think you have to have the personal stories and the data, so both of those parts are so crucial because they want to hear those things. So both of those are very important when talking to your elected officials. And I do want to challenge you all and charge you to, get it more involved, like with the research that you all are doing, go out, talk to people about it, find those personal stories, talk to your elected officials, because people don't realize that we hold the power. We, as constituents, we hold that power, and it's our job to keep our elected officials accountable for what they do.
That's fantastic. And I can assure you from my own experience, when Ashleigh and her colleagues come to the Hill, legislators listen.
Yeah.
They have no way to escape. Maryann, you were talking a little bit about the MAP project, the multidimensional aspects of poverty project, and how that was different and how it involved people with lived experience as researchers, which is so fascinating. Can you talk a little bit about how that has changed the outcomes of that research, and also what do you think, should all research projects be run like that?
Yes. So that's my answer to the last part of it. So the way that this worked was we used the emerging knowledge methodology, which takes activists, which are people with the direct experience of poverty, academics, and practitioners, and they work together on a topic. Ours was looking for the dimensions beyond a monetary standard for poverty. And we designed a research team, and it had equal members of all of those groups on the team itself. And we had to work together to find a balance with that, because every person is on equal footing, and sometimes that's a little hard because for people in poverty, maybe if you're looking at one group as an authority figure, so you need to feel comfortable first in that team. So we needed to set the conditions so everybody would be comfortable. And once we were able to do that, we were able to design, implement, and review the data and write the report of what we found coming from people. So here's a perfect example. MPI, Multidimensional Poverty Index, has 3 dimensions of poverty. In the United States, we recognized 9, and we also recognized that there was constants and aggravators, the things that kept coming and showing up in each area. The constants are the things that are always there. The aggravators that can make something worse for people in poverty: social identity, racism, time. How long you're in poverty has a greater effect on you, whether you start from birth, as Ashleigh said, or if it's just like when they talk about in COVID, people were new to poverty because of that. So how that can affect you over a lifetime. All of these things that came out. But going back to the MPI, one of the dimensions is education. And the standards for that is education compulsory? Is it do girls have education? So 3 just indicators of that. We didn't name education as a dimension. We put it under resources because we saw education was a resource for people to move out of poverty. And under education, we talked about everything from, do teachers have what they need in order to be trained to serve their students? What is the size of the classroom? Is there internet access? How old are the textbooks? Right down to what is the quality of the lunch that children are receiving in school, and is it free and available to everyone? So these are the things that come out when you sit there and you talk to people and you listen, and most of all, listen to people and find out what their biggest concerns are, and how you ask the questions of people and let them just, if people start telling you their story, you need to know what to listen for and how to go about and say, oh, oh, my child was late for school. I got a letter saying that my child's been late to school too many times. Well, why? Well, what's going on, Or, maybe it's because someone became unemployed and they don't have the money for the transportation, so they're walking to school every morning. Or maybe they took a second job and they're working late shift, so they can't get up in time to make sure the child is up and ready. So there's issues to ask, not just like, oh, well, we need to get you a new alarm clock. We just need to work with people, and that changes the outcomes of the research that you do. I think they're more in-depth and more fruitful when you work with people as co-researchers.
That's a couple of great examples there. Ashleigh, on that note of real engagement with the community, can you talk a little bit about your experience with a program that we call Community Impact, which is like forming a coalition in the community between all the local stakeholders, yes, including organizations like SAFE, but also others, to find local solutions that people have already found or that they want to scale. Can you talk a little bit about that work and how it's different and how the impact?
So in my community, we have our hospital system ballot, and part of that is the strong ACC, which is a strong accountable care community, and it is a local coalition of over 200 organizations, and that ranges from community faith-based organizations, educational institutions, healthcare organizations, and regional and local businesses that have come together to look at issues in our area and what we can do together to help support children and families to be able to be successful. One thing that I've learned from this is a lot of us have the same missions and we're trying to do the same work. And so we're kind of doing our own thing as our own organizations, but it's like with this, we come together, and when you put your powers together, it's more impactful. So basically, we're just trying to transform the health and education for families and children in our community because like poverty, with going back to like the Farm Bill, like nutrition, that affects a lot of stuff. So when children don't have adequate nutrition, it affects their education. And we know if children had adequate nutrition, they're going to be more successful in school, they're more apt to attain a higher education, and then hopefully like break that cycle of poverty. So that is something that we are working at in our community, especially around early childhood nutrition and health.
Thank you so much. I think we're sort of at time. I wanted to thank both of you for amazing, powerful, tangible examples of why it is important to include, to have people with lived experience as co-researchers in your projects and programs. I think we've also heard that we'd like to see more activism also in this community. Activism that tells stories. The data are incredibly important. They are compelling. We need them. We need equally compelling stories that I'm sure you will have when you when you mine your data. There are unbelievable stories there. Become storytellers. Work with communities. The dignity point, I think that Maryann raised a couple of times, stands out for me certainly. Do we always do that equally well in all the communities where we work? I know for a fact that Save the Children, of course, has things to learn and to improve there. And make it, as you heard, on the Hill, when we're advocating for policy change, whether it's in this country or in others, make it personal and get up there and have those conversations. Thank you very much.
Thank you.